Our next hero in the behavioral health category is Dr. Michael Miller, Medical Director of the Herrington Recovery Center at Rogers Memorial Hospital. Dr. Miller has been practicing addiction medicine for more than 30 years. As the Medical Director of Herrington Recovery Center, Dr. Miller devotes his time and expertise to providing comprehensive behavioral health for people suffering from addiction. Formerly, Dr. Miller chaired the Wisconsin Medical Society Commission on Addictive Diseases, and he is currently the Vice Speaker of the WMS House of Delegates. So please help me welcome Dr. Michael Miller.
I usually talk extemporaneously, but it's a time limit, so I got notes. But very similar to John's message. Certainly I want to thank BizTimes Milwaukee for this recognition for identifying heroes within the healthcare industry and our community. Thanks to Potawatomi for hosting this event. And this morning I also want to thank Rogers Memorial Hospital for the opportunity to work in such a high-quality healthcare delivery system. We're now recognized as the fourth largest private behavioral health system in the nation. We have 6 locations in Wisconsin and a growing national presence with specialized clinics in Tampa, Nashville, Chicago, and Minneapolis. Through my own involvement with state and national medical organizations, including the Wisconsin Medical Society, the American Society of Addiction Medicine, the American Medical Association, I've had the opportunity to lead efforts to establish standards of practice for physicians who work with patients with addiction, and criteria for placement of patients and the proper level of care when they need treatment for addiction. I've led efforts to define addiction as a brain disease. We say that addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. You know, just as cardiovascular disease damages the heart and diabetes impairs the pancreas, drugs hijack the brain. And addiction involves changes in the brain. And that's what we need to recognize. So, you know, I reflected on today's ceremony and this concept of heroes and what makes a hero. And I know that in my work, I'm not the real hero. It's my patients who are the heroes. Each day, I'm impressed with the courage that my patients have to get honest with themselves, to recognize how they've been minimizing things while addiction has been destroying their life and the lives of people around them. But then they step out of the darkness and they enter treatment and they embrace recovery so they can again function productively in their families and in their communities. It's also their family members who have the courage to push them and to even prod them and to support them on their recovery journey. I would call that heroism. And those individuals, not celebrities, but everyday folks who have entered recovery, then having the courage to become a face and voice of recovery. These are the real heroes, and we have several sitting at the Rogers table today. These are the kinds of people we should all recognize in our communities. And to businesses, businesses need to support their employees who have these brain diseases, psychiatric and addiction problems. They need to support efforts at getting people into treatment and recovery. And those business leaders who have enlightened policies for employee assistance when people have addiction or psychiatric problems, I really would like to commend them and encourage everyone in the business community to become a hero for supporting those in their workforce with these often misunderstood and stigmatized diseases. Thank you so much for this honor. Appreciate it.